Presentation is on pronation of the feet. Now going right into it, identifying what overpronation is. Pronation of the feet is often characterized by pes planus. Pes planus is often known as flat feet, and those with flat feet have less than a normal arch and are often displayed increased pronation of the foot-ankle complex. Increased pronation is characterized by feet flattening, externally rotating and everting of the feet, coupled with tibial internal rotation, knee valgus, and femoral internal rotation. As the book states, the hyperpronation has been associated with lower leg dysfunction and lower limb pathology. Increased hyperpronation may also cause increased anterior pelvic tilt, potentially leading to tightness of the hip flexor complex. And as you can see by this picture here, we see the femur internal rotation along with the tibial internal rotation, which results in knee valgus occurring here because the feet are pronating inward towards the midline here. Now as we move on, we can move to our static postural analysis, and we will use this analysis to identify muscle imbalances that are going on, and we will base this off of our 4 kinetic chain checkpoints, which occur down the feet, at the foot-ankle complex, the knees, the LPHC, the head cervical spine area, which is also known as the upper body. And as we move on to our subject, we would expect to find that from the anterior view, the feet and ankles, we want those to be straight and parallel and not flattened. The knees to be in line with the toes. LPHC, we want both the superior spines to be in the same transverse plane, and we can see that the right hip is slightly elevated. And moving on to the shoulders, we want both the shoulders levels to be elevated and not rounded, and we want the head to be in neutral position. And what we found is that the right hip, once again, is slightly rotated, or slightly elevated, and because the knuckles are rotated and facing forward, this could be a sign that the pec muscles up here are slightly overactive. Now from the lateral side, what we would expect to find is that the foot and ankles are in neutral position. We want the knees to be in neutral position. We want the pelvis to be in neutral position as well. However, we can see that based upon this photo, she has anterior pelvic tilt going on, which could be explained by lower cross syndrome. We can also see that the shoulders up here, that there's normal kyphotic curve, and we can also see that her head is excessively extended forward, which could be a sign of upper cross syndrome, because her ear is not in line with her shoulders, hips, knees, and ankles. Now with lower cross syndrome, the muscles that we would expect to be overactive would include the gastroc soleus, hip flexor complex, adductors, latissimus dorsi, erector spinae. The underactive muscles would be the anterior and posterior tib, glute max, glute med, transverse abdominis, and internal obliques. Along with that upper cross syndrome, we would expect the overactive muscles would include the upper trap, levator scap, sternocleidomastoid, scalenes, lats, teres major, subscap, pec major, and minor. Underactive muscles would include the deep cervical flexors, the serratus anterior, rhomboids, mid-traps, lower traps, teres minor, and infraspinatus. And moving on to our posterior view, we would expect the feet and ankles to be straight and parallel. They're not overly pronated. The knees to be in neutral position. The pelvis to be level in that both posterior superior iliac spines are on the same transverse plane. The shoulders need to be level, and the head needs to be in neutral position as well. We can see that everything is as it should be, and that no muscular imbalances are found from the posterior view. Moving on to our transitional assessment with the overhead squat. This is a transitional assessment because the base and support of the subject is not changing during the movement. In this process, by performing this assessment, it will provide a better observation of the functional status of the subject, and we will be analyzing the same kinetic chain checkpoints as used in the static postural analysis in order to identify if muscular imbalances are occurring. The purpose of the overhead squat is to assess dynamic flexibility, core strength, balance, and overall neuromuscular control. The movement is also a reliable and valid measure of lower extremity movement patterns. Results that are observed during this analysis may be the result of alterations in available joint motion, muscle activation, overall neuromuscular control, which can point to those with elevated injury risk. And as we go through our overhead squat, we will be referencing the overhead squat solutions table provided by NASM, and this gives us compositions to look for and in which view we would see these compositions occurring best. For example, if you look at the posterior view, we would best be able to see if the feet flatten, if the heel raises, or if there's an asymmetrical raise shift, And if any one of these compensations are occurring, it provides us a list of expected overactive and underactive muscles, along with suggested exercises for SMR and stretches, and an integrated exercise that we can incorporate into our exercise continuum at the end of our presentation. And from the anterior view, we would expect to see these three compensations if there are muscular imbalances present, which would include feet turning out, knees move inward, or knees move outward. As the subject conducts the overhead squat, and our view is from the anterior position, we cued our subject by asking that they take off their shoes, that they stand shoulder width apart, with their feet shoulder width apart. We asked that they raise their arms overhead with elbows fully extended, and we asked that they squat like they were sitting in a chair and return to the starting position, and repeat this repetition for 5 times. Now, once again, a reminder that the compensations we are looking for from the anterior view are if the feet turn out or flatten, and if the knees move inward. These dunks here does occur, so we do your section as we assess our subject there. Once all for excessive force, lateral view, in fact, assessment, and the subject are the shift. The angle you can see by half, but the leg bound, and we will incorporate both the later on to and feet, or if the hips hike blocks. Now, one be getting into the compensations that we see. Previous be the end of these assessments to see if the stabilis is overactive, underactive, moving on. And with moving from here, ankle, lateral acer joint, hold this position, which if we would one or move such a simple 3 point, increase and then set mobility. Tibia supine below the shin and conducted the short score of 1. The by of moving on to our posterior tibialis, we found, or this test is for plantar flexion and inversion of the ankle. Muscles being tested are the posterior tibialis and anterior tibialis. Potentially overactive muscles that the strength is limited could be the lateral gastroc. And the positioning, we have the client laying supine with the knee fully extended, and the ankle is placed in plantar flexion and inversion. And for the execution, we supported the posterior lower leg just above the ankle, instructed the client to hold the position, and gradually applied an increasing pressure to the medial plantar surface of the foot in the direction of dorsiflexion and eversion, and look for compensations of the toes flexing or the foot everting. And as we can see by the video, the level of strength the client scored was a 3. No compensations or weaknesses were found, and the conclusion based upon this was that the posterior tibialis is not overactive, being that they scored a level of 3. Summary of findings so far, we found that the static postural analysis, that the feet were slightly pronated, the overhead squat, the feet were flattened. Through the gait analysis, we were able to see that the excessive feet pronation did occur. Range of motion assessment, there was a decreased range of motion in dorsiflexion, and with the manual muscle test, we found the anterior tibialis to be weak. Now this will take us into our exercise continuum. Based on what we have found through our testing, we can now take the subject through the corrective exercise continuum, in which we will inhibit and lengthen the overactive muscles, activate the underactive ones, and incorporate an integrated exercise which uses both the under and overactive muscles. There will be more detail on each step of the continuum in the following sections. Now this outline is straight out of the book, and it provides examples and techniques that could be used for individuals with foot pronation. And this chart right here is what we'll be taking our subject through. We'll be SMRing the gastrocs and peroneals, holding on tender areas for 30 seconds. We'll be static stretching the gastroc and soleus, mainly the gastroc, for 30 seconds. We will activate the anterior tibialis using isolated strengthening, using 10 to 15 reps with 2-second isometric holds and 4-second eccentric contractions. In our integrated movement, we will use the step up to bounce test. For our inhibit, decreasing overactive neuromyofascial tissue, we will use the hunt and hold technique that we learned in class, and the subject is targeting her gastroc. She has her legs crossed right there, she has her hands supported on herself right there, and she will be going down the foam roller, down up the length of her gastroc, hunting for a tender area, and when she finds one, which is shown right there by her face, she will hold that area for 30 seconds and try to inhibit that overactive tissue, which in this case is the gastroc. We will then move on to the lengthening phase. Now, the goal of the lengthening phase is to have the elongation of mechanically shortened muscle and connective tissue necessary to increase range of motion at that tissue joint. By performing the static gastrocnemius stretch and holding for 30 seconds, we will be lengthening the overactive gastroc muscle. And we can see that here by cueing the subject to brace herself against the wall, and by extending the right leg out in a straight manner, and by bending the left leg, she's targeting her gastroc of her right leg. And if she was to bend her right leg, that would target the soleus, which is not what we want to do. And this will take us into our activation phase, where we want to re-educate and increase activation of underactive tissues, which in this case would be the anterior tibialis, using isolated strengthening with a band. And we will have her do 10 repetitions with 2-second isometric holds and 4-second eccentric contractions. And as we can see here, the subject will be holding it for 2 seconds and doing a 4-second eccentric contraction down, back up again, 2-second isometric hold, 4-second eccentric contraction down, and then doing 10 repetitions of that is our goal here. And once she gets through that, that'll be the end of our activation phase, and we will move on to the integration phase next, which is this, and the goal of which is to retrain the collective synergistic function of all muscles through functionally progressive movements such as step up to bounce exercise. Through this exercise, we'll be incorporating and activating all underactive and overactive muscles, which in this case would be the gastroc is the overactive and the anterior tibialis is the underactive. So by stepping up with her right foot on the treadmill, she will be activating the gastroc, especially when she steps up right there, that's activating the gastroc. And by maintaining that left angle of her foot, she is activating the anterior tibialis. And once she has conducted 10 repetitions, she will switch sides, and that way she can activate both anterior tibialis and both gastrocs. And unfortunately, we're not able to conduct a re-evaluation on the subject, being that we had to use different subjects throughout because of availability of the subjects, but we would expect to see an increase in the range of motion assessment along with an improvement in the manual muscle test if this was followed throughout with the same subject. In the way of references, we only have the one, which is the textbook, in which we have all of our information from and all of our photos from as well.